Hello guys and welcome back to my channel. So before I say or start anything with this video and today's topic, I would first like to apologize to any of you guys that were waiting for a video. It's been 3 weeks and yeah, I really apologize for this because this is like the excuse that I have. It's because school's been starting and homework has been piling up, so I've been quite busy, but I think that's no excuse to give, especially if you were waiting for a new video. So again, I'm really sorry about not being able to post weekly as I probably have mentioned and probably promised you guys earlier on. So with that being said, I would like to introduce today's topic. And today's topic will be on breast cancer surgery types. And in more detail, it's going to be about like the breast cancer surgery types and what you can expect during surgery. So like what happens before, like in the operating room, what happens during surgery, and what the family feels and how to cope with those feelings, and then what happens after surgery and like side effects of the surgery that the breast cancer patient will get. So let's begin today's video. So first, I will be explaining the two types of breast cancer surgeries that are mainly used. So the first is a mastectomy. A mastectomy is a type of breast cancer surgery that the surgeons will pretty much remove all breast tissues to prevent breast cancer from ever happening again. And what they mean by removing all breast tissues is that they're pretty much removing the entire breast of where the cancer is located. The second type of surgery is called a lumpectomy. And what a lumpectomy is that this surgery, pretty much the surgeon will remove the breast cancer tissues only. So they will pretty much just take out the lump only as suggested in the name lumpectomy. And regarding this, a lot of people may wonder like whether they should do a lumpectomy or a mastectomy, especially if the patient is a early stage breast cancer patient. And although I cannot provide you guys a good reasoning for why you should choose one over the other, I will say I guess the main difference between the people choosing whether they want a mastectomy or a lumpectomy is that with a mastectomy, like my mom did a mastectomy, and when she first got it, she was a stage 2A breast cancer patient. And if you don't remember what these stages mean, I have attached a link at the corner, so you guys can go check out that video as well. So continuing, my mom was a stage 2A breast cancer patient, so her tumor size wasn't really that big, but she still did a double mastectomy, which means that the surgeons cut off like both of her breasts because she just wanted that extra like prevention method so that the breast cancer would not come back. But from like the blogs or articles or videos that I've seen online for people that have done the lumpectomy, they state that they did a lumpectomy because one, they didn't want to lose their breasts because, like most breast cancer patients are females, and I guess like the breasts are an important part of the female body. So they just didn't want to lose that part of their body. But second, they were really worried about how like hurtful it might be after the surgery. And they were also just not ready to see like a scar on both like sides of their chest or like on just one side of their chest. And they just thought, if I have a small tumor, let's just remove the tumor itself and not remove the breast. So Obviously, this whole lumpectomy or mastectomy is completely dependent on the breast cancer patients and what their preferences are. But whatever you do, just remember to fight on and fight that breast cancer, kill it, and make sure that it never comes back. So with that, I will go on to part 2 of this video, which I'll be talking about the processes of breast cancer surgery. So as it is with most surgeries, there are processes for before surgery, like during or like on the day of surgery, and then after surgery. So I will go in the chronological order. So before surgery, the breast cancer patients, about weeks to like a month before their surgery day, oncologists will ask the breast cancer patients to do several tests in order to see whether the breast cancer patients can receive the anesthesia for the surgery, and just to see if the tumor like hasn't grown, hasn't moved, or just to see if the body is actually working and functioning. So for instance, some of the exams that the breast cancer patients may have to go through include the chest x-rays or the electrocardiogram to see if the lungs and the heart is working properly, blood tests to see the blood count levels, because in our blood they usually check for like the immune cells, like the white blood cells and like the red blood cells and everything, and that pretty much shows that you're doing well or you need a little bit more improvement before like heading in. Then some may have to do the urine test. So the urine test pretty much sees if the kidney is working properly. And then finally, some people may have to go through CAT scans to see where the tumor is located and to see how big the tumor is. Then the second part of the surgery is the actual like what to expect during and what happens what happens during the actual surgery. So during surgery, the oncologist most likely will tell you that you are not allowed to eat or drink anything on the day of surgery, because that actually will increase the patient's chance of getting nausea when anesthesia is being done to the patients, and nausea is obviously not a good way to start a surgery. And in the operating room of the surgery, the patients will have a blood pressure cuff. They'll also have an electrocardiogram to monitor the heart rate. They'll have a finger clip, and this pretty much shows the blood oxygen levels and to see if like the anesthesia is working properly. And then for surgeries that go on for over an hour, the patients may have compression boots or blankets on their lower legs to make sure that the bloods don't clot in that specific area. Then after surgery, if for me personally, was the hardest part as well as it was before surgery. And the reason for that is because after surgery, I mean, a lot of people would expect that surgeries wouldn't have any side effects other than the physical scars or just the removal, but there are actually a lot of side effects that happened. So for instance, there can be bruising and swelling in the area of surgery. There can be a thing called seroma, which means a collection of fluids within parts of the body after surgery. Then there also is hematoma that can happen, and this is pretty much the bloods are collecting in the tissue surrounding the area where the surgery was done, and it can come off as a swelling, and it just brings discomfort and it grows a little hard in that area. Then there's also stiff shoulder and cording. And cording is pretty much restricted arm movements and pain in the arms when you move it around. Then there's a thing called lymphedema, and what lymphedema is that it's pretty much a swelling of the arms, hands, or the breast areas, and it's caused by the lymph fluid that builds up in the surface tissues of the body. Then these are like rare if you like follow the rules like correctly, but it still may happen. And these are such as like wound infections. So the surgery is gonna leave a scar on your body, and depending on like where you got it from, you might get like those strings that like dissolve over time, or like you could get like a tape over the area, and sometimes these wounds could get infected. And then another one is actually changes in like the sensation. So some may grow more like alert or dull to some senses, and that's completely like dependent on the patient once again. And honestly, all of these are dependent on the patient. And then there are scars in the body from the surgery, and then there also can be nausea. And all of these, although my mom didn't have all of these side effects, I know, and she still has the stiff shoulder cording problem. And and we like to think that it's because like she's in her late 40s that she's getting like those like post-menstrual like symptoms, but it all started from when she was done with surgery. So we believe that also like on the one hand that it could be due to the surgery. And pretty much like when I see my mom, I don't know if this goes for other patients that had cording or the stiff shoulder problem as well, but she's not able to like lift her, like raise her arms like up high, and she feels like great pain, like even if you like touch her shoulder like slightly and it moves in the wrong direction. And like she has like a really hard time like just moving around this particular area. And so for this, we actually never thought about it because my mom, she had it on her left shoulder first, and it actually disappeared over time. And over time, I mean like a couple of months to a year, I think. But it reappeared on her right arm now, and we just hope that it will go away. But she says it's been hurting more lately, so we bought like one of those like compression, like shoulder compression casts thing, and she says that she thinks that helps a lot. And also, if you like massage the breast cancer patient's like area where she's experiencing those pain, I believe that this will be a good way to help heal that area faster. So I've already been talking about my mom, but if I should start from the beginning of how her processes went. So my mom got a double mastectomy, so that means she cut off both of her breasts. But she actually had stage 2A breast cancer. So if you don't remember or recall from my like past video, I mentioned about how big the tumors for each stages are, and I would have linked it on the top, so you guys can go check that out if you don't remember. But my mom had stage 2A breast cancer, but she still did a double mastectomy in order to prevent the breast cancer from ever like occurring or ever like growing again. And I remember like before surgery, she was obviously very nervous, but it wasn't until actually like after surgery that it, I guess, really hit hard for me because before surgery, we were there, we saw her being rolled in, and it was just fine. And then during surgery, it took a long time. I remember having like eating something because I was like hungry, like a little bit of fruit and a little bit of snacks, I think. So pretty much what happened is that during surgery, uh, I was very nervous, obviously, because um, like it's not like we're in the room and we can't see how the surgery is going. And although they do update you, I think I recall them giving us an update to see like oh, your mom did fine, but that was like after the surgery was over. So during surgery, I was pretty much like worried. Like I actually didn't know that it would take that long. So for like a first hour or so, I remember just being like calm and collected and thinking like, oh, my mom's gonna be here soon, it's fine. But after a certain point, I remember being so nervous because it was taking longer than what I thought. So, I don't know if I've actually mentioned this to you guys before, but I'm actually Christian. So I prayed and prayed, hoping that she'll come out of the surgery room better than ever and that everything would just return to normal. And then, yeah, anyways, in the middle of praying, I remember the doctors and nurses wheeling her in and then moving her onto like the bed that they like already prepared for her. And they were telling me that the surgery had gone well and that she was like fine. And then when she woke up, to like tell her to take some pills in order to reduce the pain. But the funny thing was, my like on the internet before she did the surgery, me and her, we both did a lot of like researching to see what would happen after the surgery because we were very worried. And a lot of people said that they felt pain in the area, like really strong pain in the area where they had the surgery. But surprisingly, my mom actually didn't feel the pain and she was actually like completely fine. And even the doctors were surprised and they were like, oh, you don't feel any pain? That's good, but like that's surprising. And yeah, it's pretty odd, but it was, I mean, happy for us. But after surgery, she also had like these, I think they're called wound drains. So there were like these tubes attached to like the side of her body, and it collected like the fluids. And what happened was that she had to carry those on for some time before they removed it from her. And honestly, it was just really hard because like when you looked at her, like she looked fine, but then you would just keep on looking at her and then realize that she wasn't the same as before. But yeah, anyway, she had those tubes in her body and it was just hard watching her. But after surgery, as I said before, she got the stiff arm and the cording, and the doctors actually recommended her not to lift anything too heavy or like that puts like tension in the shoulder arm area because that could cause like severe pain and nobody would actually want that. So, but from my mom's story, from my mom's processes, although it was like she only did the breast surgery one time, so I mean, I guess I can't say that I have experience with this specific expertise, but through this, I felt like I grew more cognizant of the situation. And surgery is one of the hardest times alongside with the treatments. The whole process is horrible and hard on the family and the patients. But what I remember just during the time was how positive my mom tried to be even with the tubes in her body, and even though she was having a hard time, she would joke around about the tubes and be like, "Oh, I have tubes sticking out in my body," and she would try to make the mood lighter so that she herself would feel a lot more at ease, but then she would also help me feel more at ease as well. And I remember in me, during that time, I just didn't want her to worry about the tubes or anything, so I just never brought that topic up and just went on with her as if that whole thing was just not there, and just try to make her as happy as possible. So yeah, that was my mom's story on the breast cancer surgery. And that's how I dealt with everything. And of course, I know that you guys will have different processes than I did as to how to treat your parent that had breast cancer. But what I guess I'm trying to tell you guys is that, for me, what I realized is that no matter the treatment, surgery, or whatever process the breast cancer patient is going through, just making sure that the patient has no stress on their mind and on their physical body as well, and that they're as happy as they can be, will just make the whole process faster, and they will heal a lot faster as well. So now I will move on to the ending of the video. So by watching today's video, I hope you guys have learned about the processes and the two types of breast cancer surgeries. And I guess as it is with most of my videos, I hope the biggest takeaway with it was that you have to bring the breast cancer patients joy and leave them with no stress in order to make sure that they recover, and in order to make sure they heal quicker than what is possibly deemed normal. And again, I would like to really apologize to everyone that was expecting a video 3 weeks ago, but just me being late in posting this video, and I hope you guys can forgive me on that. So with that being said, I will see you guys next week with a new topic. Thank you guys.